Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. UK government commits to more vaccine donations with hopes that Nigeria will get a bigger shipment. The National Association of Resident Doctors issues a fresh 4-week ultimatum to the government over unpaid allowances. The president of the African Development Bank, Dr. Akinwumi Adesina, says Africa needs to start producing and not beg for COVID-19 vaccines. He said this during the opening ceremony of the 2021 meetings of the African Development Bank recently. According to the AFDB president, the coronavirus pandemic impacted African economies negatively as countries are estimated to lose between $145 billion and $190 billion in the gross domestic product, GDP. In the meantime, the Nigeria Centers for Disease Control, NCDC, confirmed 44 new cases of COVID-19 last night across 3 states and the FCT, with Lagos topping the charts. Let's take a look.
In continuation of the trend of low daily count of COVID-19 infections, the Nigeria Center for Disease Control has announced 44 new infections reported from 3 states and the FCT in the last 24 hours. Again, Lagos had the highest figures with 32 cases. Rivers reported 8 cases, while 2 cases were reported in Plateau and the FCT. The latest tally also includes data from 3 states and 0 cases from Imo, Kano, and Sokoto. Till date, Nigeria now has a total of 167,375 confirmed cases. 4 people have also been discharged after testing negative to the virus, raising the total number of recoveries to 163,917. For the second time in a row, no death was recorded in the last 24 hours, leaving the fatality toll at 2,118. The latest update by the National Primary Healthcare Development Agency shows that more than 2 million eligible Nigerians have been vaccinated with the first dose of the Oxford AstraZeneca vaccine, while over 1 million of those vaccinated with the first dose have now received their second. The agency is also advising eligible persons who are yet to receive the second dose to do so before the close of the exercise on the 5th of July. In Africa, there are over 5.2 million confirmed cases and more than 138,000 deaths on the continent. Across the world, more than 179 million confirmed cases, while deaths have surpassed over 3.8 million.
The United Kingdom has made a commitment to support Nigeria in the provision of COVID-19 vaccines. The Development Director of Foreign Commonwealth and Development Office of the UK government confirmed this to newsmen in Dutse, the Jigawa state capital. Our correspondent Sadiq Ilyasu reports.
Jigawa State in northwest Nigeria has a population of over 5 million, which would require at least 10 million doses of a 2-shot COVID-19 vaccine like Oxford AstraZeneca. When the first consignment of the vaccine arrived in March, courtesy of the COVAX facility, the federal government allotted 70,000 doses to the state. Frontline health workers, some government officials and community leaders were prioritized. Now the UK government is stepping forward with a commitment to increase its contribution, with the hope that more vaccines will get to Nigeria, a move which the Jigawa State governor is pleased with.
We know that there is a big push by the state governor, by the emir, and by others in the government to ensure that people get access to the vaccination. And the UK is one of the largest providers of support to the COVAX facility, which will make sure that vaccines are available. And the Prime Minister of the United Kingdom at the G7 made a pledge to increase the amount of vaccines which will be made available to developing countries, and we hope that some of that will come here to Nigeria and to Jigawa.
I will want to say thank you, but words will not be enough, really, to thank Her Majesty's government for the support that they have been rendering to Jigawa State and Nigeria in the last 20 years.
Vaccines are the surest way to build immunity against COVID-19, and nations, including Nigeria, are racing against time to ensure at least 70% coverage, which is required for herd immunity, where the number of immunized people act as a shield for the non-immunized. The Jigawa State government is urging residents to get vaccinated, but not neglect the non-pharmaceutical interventions of mask wearing, good personal hygiene, and avoiding crowds. From Dutse, the Jigawa State capital, Sadiq Ilyasu, Channels Television News.
The impasse between resident doctors and their employers in the state and the federal government is yet to be settled as the Nigeria Association of Resident Doctors, NARD, is issuing a fresh 4-week ultimatum for their demands to be addressed. The doctors told journalists at a news conference in Abuja that they will be having another meeting with the federal government in July, insisting that issues including hazard allowance for members and unpaid salaries by some state governments have not been met. The association is now asking the government to walk the talk and implement the agreement or risk another strike after the expiration of the 4-week ultimatum.
Federal government and state be given 4 weeks to resolve all impending issues as stated otherwise. They urge the federal government to be more serious by coming up with the desired amount of hazard allowance in the upcoming meeting on the 6th of July. All salary shortfalls and minimum wage consequential adjustment areas must be paid to all affected members. The next demand that all the state governors yet to adopt minimum wage adjusted 2021 should do so as a matter of urgency. All state governors yet to domesticate the Military Training Act should immediately do so in order to maintain industrial harmony with our members under their employee.
And to prevent overcrowding during the continuous voter registration exercise, the Independent National Electoral Commission, INEC, has restated that the June 28th date remains sacrosanct. Professor Mahmood Yakubu stated this on the launching of the online registration portal for the CVR at the conference room, INEC headquarters, Abuja. According to him, the intention of the commission was to resume the CVR early in 2020, but because of the COVID-19 pandemic, that and other activities which precedes the resumption of the CVR could not be concluded, necessitating a review of INEC's processes. Speaking today, Professor Yakubu believes that the register of voters is at the heart of democratic elections and hopes that through this portal, people can be protected while exercising their fundamental rights, especially in the context of the coronavirus pandemic. And the World Trade Organization recently announced the regional vaccine manufacturing hubs in 4 African countries, including Nigeria and South Africa. Well, how promising is this path to future pandemics? Joining us right now is Mr. Sam Ohabunwa, President, Pharmaceutical Society of Nigeria. He joins us from our Abuja studio. Thank you for joining us on the program.
Thank you, Millicent. Good evening, Nigerians.
Let's begin by getting your thoughts on the vaccination drive across the country. What do you think about it? How do you feel about the processes so far?
Well, I would like to think that the effort has been reasonable and also a measured success achieved. But if I use my own experience, I still believe that a lot more needs to be done because my experience was the first time I logged in, I was booked into a health center. I went to the health center. The health center was not functional. So I had to find my way to some other places, and it took quite some processing. I had to start calling people that I knew who could assist me to get vaccinated at that center. When I went for my second dose, I was stopped at the gate and I was asked, "Are you coming for your first or second dose?" I said, "I'm coming for the second dose." And then they had to check me and clarify that that was what I was coming to do, kept me aside before. For me, those are normal processes, but what I feel is that if we need to truly deal with hesitancy. We should bring some motivation. When I did my first COVID test in the United States, the moment I finished the test, they offered us bags of food, flowers, and all kinds of things as incentive and motivation, perhaps for me to come a second time. So I think that the hesitancy we're dealing with in Nigeria, we need to do more than just what we've done. But if you ask me, I think that the government has tried, haven't remained consistent on the message from the beginning to now. But in terms of motivating people for vaccination, and of course, some who went recently to get vaccinations were turned down, presumably because what was brought in March will not be able to be useful after a couple of weeks. And so those people, the focus was to finish the first group of people. And I think so more effort needs to be made to get the vaccines, and then thereafter create some motivations, including expanding the roles and the sites where people can get vaccinated.
I'm sure that on the part where you talked about incentives, the authorities are listening, but calls to scale up vaccine production capacity in Africa, they're growing louder. Does the continent have the capacity to produce vaccines, seeing as we're having these regional production hubs coming up in some African countries?
Well, in theory, there is some capacity in Africa. Certainly, that capacity is limited, very, very limited. Maybe in Egypt, maybe in Senegal, and South Africa. Elsewhere, I'm not sure. Nigeria certainly, for now, does not have the capacity in terms of the site to produce vaccines. Human vaccines. I must admit that Nigeria is producing animal vaccines at the Veterinary Research Institute in VOM. They're producing vaccines for animals. But for human, the only lab we had in Yaba has been moribund, and effort to resuscitate it through some mechanisms have not quite worked out. So right now, Nigeria does not have the capacity in terms of available site. They may have the personnel because we have health scientists, pharmaceutical scientists, pharmacists, biomedical scientists, microbiologists, and people who know how to research and produce vaccines. But the facility, because it's a very, very highly regulated production process, it must be at the higher levels of GMP, and this kind of plant cannot be set up in 1 day or 1 week. It will take you, with all the money you can get, you can't get a vaccine plant running in under 1 year. And I do not see anyone in motion as at now. So capacity is limited all over Africa, but I believe that a few countries are better. Those 3 countries or 1 or 2 others are better primed than Nigeria to be able to produce vaccines. However, it's still better to have some sites in Africa. I hope that it will be easier to get vaccines from South Africa or from Cairo or from Senegal than waiting for it to come from the UK or elsewhere in Europe or in the United States. But the capacity today is insufficient and continues to call back to the fact that Africa especially needs to get its acts together, put its money in the areas that are critical. We can't continue to depend on the world for everything. For many years, we've been doing childhood vaccinations, polio, tuberculosis, diphtheria, measles, and we are just depending on the world to give us the global funds to produce. And so it's becoming, for me, a big challenge that Africa needs to wake up and take responsibility for the health of its citizens and not depending on foreign aid and foreign help all the time. We should come of age.
We'd like to thank you for indeed all you've said on this particular issue. Thank you so much, Mr. Samuel Habonwa, President, Pharmaceutical Society of Nigeria. Always a pleasure having you on the program.
Thank you very much.
282,000 teaching and non-teaching staff at South African school have started receiving their COVID-19 vaccination. The process began after months of debate and disruptions in the school calendar in some parts of the country. Channels Television was at the flag-off of the process at the Rabasutu Community Hall in Tembisa, Johannesburg. Our South Africa Bureau Chief Betty Divia reports.
As promised during a weekend briefing, the Johnson & Johnson vaccine is getting into the arms of those in the education sector.
I am elated, I am encouraged, and I am hopeful that indeed what we committed as the education sector, because we're the ones who put the timelines, to say we need 2 weeks because we don't want to disrupt schooling. And when we close on the 8th, we want to be done.
We are very pleased that after all the battling, we are able to assist the education sector in making sure that we can provide the vaccines.
With the school calendars interrupted several times and COVID casualties recorded in schools across the country, government has been criticized for not regarding the workers in education as frontline workers much earlier.
We can't risk to have a full generation that will not be given the necessary support that they need. The experts have indicated that the closure and opening of schools since last year, we've lost almost between 3 to 5 years of schooling.
There have also been calls for a boycott of the vaccine process, but the department has promptly tried to calm anxiety, and these teachers are calling on their colleagues to get their shots as well.
I'm encouraging all the teachers in the country to follow suit because it's for the safety of their health, but also it's also for the safety of the children that they will be teaching in school.
Well, I will encourage everyone to take a vaccine for the sake of yourself and your family, because you don't know how strong is your immune system, how will it respond if you happen to be infected with this COVID virus.
Barring any hitches, the vaccination process for teaching and non-teaching staff across the country is expected to be concluded in 14 days. From Johannesburg, South Africa, Betty Divia, Channels Television News.
Now, most regions in Germany and Italy have been excluded from Spain's high-risk list of countries and areas based on the COVID-19 infection rate. As a result, Spain now permits citizens of those regions to travel the country without being obliged to present a negative result of the COVID-19 test or proof of vaccination or recovery. Now, such a decision has been confirmed by Spain's health ministry after it updated its entry requirements for European Union and European Economic Area, and it's expected to boost the number of tourists in the European country. Idris Abdullahi, Maria Sklodowski Curie Fellow, Research Staff, Biomedical and Biotechnological Sciences, the University of La Rioja, Logroño, Spain, joins us now. Thank you for joining us on the program.
Thank you. Thank you for having me.
All right, tell us about the coronavirus situation in Spain.
Well, virtually at the initial stage of the pandemic, the entire European countries were hardly hit by the virus. But at the end of 2020, almost everybody agreed or accepted the vaccination would be the only solution for this pandemic. And fortunately enough, with the discovery, evaluation, and the implementation of the vaccination program all over Spain, for some few months now, from April, May, and June now, we've not been having high cases of the coronavirus. Perhaps maybe due to the high uptake of the vaccination by the citizens and then the legal residents as well.
Essentially, what has been your experience living there and the restrictions that are in place at the moment?
For citizens, I mean, for people living or residing in Spain, there are no much restrictions for now. Towards the end of May, we were having a restriction that starts from 11 p.m. till 6 a.m. But about 2 to 3 weeks ago, it was lifted. For now, there is no any restriction within people. I mean, on people living within the country, but people trying to come in from neighboring European countries, of course, you need to present your negative PCR result or complete vaccination program. With this, you will be able to come in and do whatever you intend to do in Spain.
Okay, you've talked about how well vaccinations are being accepted, so perhaps limited hesitancy or even none at all. But then what is the speed that the country is vaccinating? We have, other countries like Israel and some other countries in Europe that are vaccinating quite fast.
Well, for we in Spain, I think we didn't have any problem accepting the vaccines, except towards I think April or May thereabout, when we had the cases of adverse reaction due to AstraZeneca vaccination, of which the European Medical Association swing into investigation, and they came out with a good result that it wasn't associated with the vaccine. But for now, I think the major vaccination program we take in Spain for now is the Pfizer. Pfizer is meant for people over 50 years, whereas we use Moderna for people below 50 years and then above 18 years. Like myself, I just took my second shot yesterday of Moderna. So for now, I think based on information we had, about 45% of the citizens have been fully vaccinated by at least one dose of either Pfizer or Moderna.
All right, we wish you all the very best. We appreciate your time on the program. Idris Abdullahi, thank you for joining us.
Thank you for having me. Thank you.
Australia's most populous state, New South Wales, has reported a double-digit rise in new locally acquired cases of COVID-19 for the third straight day. Officials fight to contain an outbreak of the highly contagious Delta variant. Now, since the pandemic started, it's calling it the scariest period that New South Wales is going through. Here's more on the global coronavirus update.
Australia's most populous state, New South Wales, is experiencing the scariest period since the pandemic started, after it recorded a double-digit rise in new cases today.
Since the pandemic has started, this is perhaps the scariest period that New South Wales is going through. But that's so long as everybody does the right thing.
New restrictions, including compulsory mask wearing indoors in Sydney, home gatherings have now been limited to 5 people, and restricted movement regulations have also been imposed for 7 council districts in the east and inner west of the city. Over in Brussels, German Chancellor Angela Merkel is calling on the EU to adopt a more unified approach regarding travel rules to slow the spread of the more contagious Delta variant of the coronavirus. In an effort to stop a coordinated Europe COVID-19 plan of action, Austria has welcomed a proposal by Germany and France to seek a summit with Russia's President Vladimir Putin. British Prime Minister Boris Johnson doesn't plan to rule out going abroad for his summer vacation this year, as the government views easing restrictions on travel for those who have had 2 COVID-19 vaccination doses. Despite this, he responds to the German Chancellor's call for tougher travel restrictions, saying this is not going to be a summer like every other summer. It's going to be a more difficult summer to take a holiday. In Japan, the Prime Minister says the government is focusing on speeding up vaccinations in an effort to revitalize the economy. Japan's economy shrank an annualized 3.9% in the first quarter, and many analysts expect any rebound to be modest in April to June, as state of emergency curbs to combat the pandemic induced light consumption. Afrigen Biologics, a South African biotech startup, is gearing up to produce Africa's first COVID-19 vaccine using the mRNA platform.
The race is on to get manufacturing capacity in Africa to give us vaccine security. However, there is a place for other platforms, particularly in the area of stability.
Currently, there is no capacity in Africa to make a vaccine from an mRNA platform, so the first step for the company will see a group of scientists being sent to selected tech transfer partners in the United States or Europe for training.
Take responsibility to protect others if you're experiencing symptoms associated with the virus. You can visit our website. It has more updates. You can see more on the pandemic, plus other stories and business news, sports and entertainment. It's at your fingertips. It's channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay safe.